Good morning. Welcome to Travis Talks and Anthony. Today we're going to have a insightful conversation. For those that are new to the channel, we make mental health conversation content that's going to be beneficial to your personal development in addition to your well-being. However, in today's conversation, we're going to be talking about mental health stats, understanding the impact of mental illness on society, right? So I want to be able to provide some statistical insights on prevalence of mental health conditions and their impact, right? So off rip, mental health doesn't just affect individuals, right? So it shapes communities, economies, and the fabric of society, right? So some research that supports, it says, statistical data on mental illness helps policymakers, clinicians, and even public understanding prevalence trends and unmet needs. So what's really going on, where are we heading, right? And just the data itself allows us to look at numbers and where are we heading, where we're going. And accurate metrics in regards to the guidance, resources allocation reduces the stigma through awareness, a measurement progress in regards to care and prevention according to the CDC, right? So it's important to know what's going on. It's important to reduce the stigma of mental health to help us, get that awareness, understanding, and for us to get the support and the love that we need, right? So we all matter, right? We all got a brain, right? We got mental health, and we got to provide that as a priority, right? So stick with me, grow with me, and we'll be able to navigate throughout this video. So off rip, our first segment, we're going to be talking about the prevalence of mental health conditions, right? So let's dive into our first key concept. Overall prevalence, right? So a significant percentage of adults and youth experience a diagnosable mental health condition in a given year, according to the APA. In addition to that, too, we have the common disorders, right? So we have anxiety, depression, we have substance use disorders, a mood disorder, ranking among the most frequent reported conditions. So, what most people have, what seems to be those common disorders, we're able to look at the numbers, how is it affecting, youth, adults, etc., right? So we need to be able to know what's going on in that sense. We also have the youth impact, right? So a growing number of children and adolescents report persistent feelings of sadness, anxiety, and stress, according to the CDC, right? So these are common mental health prevalence in regards to, like I said, the stats and numbers. It allows us to know what's really going on, who's being impacted, and how we're able to support these individuals, right? In addition to that, too, we have global burden. So this is, like worldwide. It's not just in your state, maybe your community, right? Maybe your town, right? We got to look at what's going on around us in that sense, right? So global burden in that sense. So mental illness are, among the leading causes of disability worldwide, right? So we got to take that into consideration that, like I said, it's not just you and your community, your town, etc., right? This is a global thing. It's affecting various people on a large scale. Moving forward, in regards to our next segment, we're going to be talking about the daily life and functioning, right? So how this impacts us in our world. Right, so we have work impact, right? So mental health conditions contribute to significant absentness in that sense, right? So reduced productivity and workplace disability. In regards to daily functioning, we have education. So students with untreated mental health, challenges often face academic difficulties. How can they focus, right? How can they, we also have absence, right? And lower graduation rates, right? So how can they focus? How can they feel adequate? How can they really concentrate and try to get, where they need to be when the mental health is causing them a significant disturbance in regards to their daily function? We also have social relationships, right? So emotional disorders can affect, interpersonal connections, family stability, and even that social engagement, right? So, loneliness is a big thing, but there's also too something that's called isolation, where people are choosing not to interact, right? Based off of these emotions, these feelings, and even these emotional disorders, right? So we got to take that in consideration because it impacts, like I said, the daily functioning. We also have quality of life, right? So individuals with mental illness often report lower overall life satisfaction and well-being, right? So mental illness is real. That's why I said it matters. You matter. We all got a brain. Our mental aspect of our control center of our brain is being impacted. This is a warning sign. This is something that's a red flag. This is something that we got to be able to, like I said, take as a priority with love, compassion, but we need to be able to have the proactive supports, right? So mental illness, and like I said, the data, the information, the stats, where we headed, where we going, this all matters, right? So we got to look at this as a significant thing, and it is essential to know. Moving forward, in regards to our next segment, we're going to be talking about the economic and community impact, right? So how does this impact not just us, but around us, right? So healthcare costs, right? So mental health care and related physical, health conditions contribute to rising medical costs, right? So that definitely takes a toll. We also have workforce loss, right? So loss in regards to earnings due to mental illness and disability account for billions in the economic costs annually, right? So those out there that are losing their jobs due to their mental illness or disability, this definitely takes a toll, right? In that sense, and in addition to the community. We also have public services in regards to increased demands for social services. We have crisis care. We also have law enforcement involvement that adds into community strain. In addition to that, too, we have homelessness in regards to the justice system. So we have a disproportionate number of people in shelters or jails that have been, untreated in regards to their mental health conditions, right? So this is definitely impacting people in various communities and various aspects of life, depending if they're in society or not in society, right? They are people, they have a brain, and this definitely impacts, right? Like I said, their health in addition to their mental health. So I really want to take that in consideration, that this is important. And like I said, it's important for us to know the numbers, to see how it's not just impacting us, people around us in our community, our town, etc., but even the world, right? This is a really major thing. Next segment, we're going to be talking about disparities and access to the care, right? So we need to know who's being impacted, who's not being impacted, right? Why are they not getting the care that they need? Is it based off of the resources not being distributed to them, or is it based off of the individual not seeking them, right? So what's really going on here, right? So let's get back into this, right? So we have racial and ethnic disparity, right? So certain populations experience higher barriers to diagnosis, that treatment, and even that support, according to the CDC, right? So there are, elements to this where there are disparities based off of that racial aspect, right? So once again, is it based off the person not seeking the support, or not being knowledgeable of the support, not having the support, or the person that is a provider not even want to help the person? So we need to know these things, and this is something that is involvement in regards to that disparity. Moving forward, we have the rural and the urbans, right? So geographic location often influences the access to mental health providers and services, right? So it's depending on where you live, what you're around, these things definitely impact, the resources and So moving forward from that, we also have the age differences, right? So older adults and children face unique gaps in care and tailored intervention. So this is something that is really important, and something to really, like I said, kind of keep the like a zoom on it type of thing. I'm trying to think of the name, but it's like a microscope in a sense, where it's like really able to look at these numbers, look at these populations, and really figure out why do we have these disparities, and how can we really improve these unmet needs of these individuals for that care. We also have insurance coverage, right? So many diagnosable, individuals, conditions that lack adequate insurance or mental health benefit coverage impact, access to that care, right? So it's important for us to know these things. That's why I'm saying acquiring the knowledge, really understanding what's going on with other individuals, right? But these impact an individual based off their mental health and seeking that access to that care. Next segment, let's talk about positive trends and opportunities. Let's look at, we've seen the negative aspect of this thing, and how people are being, neglected in regards to the needs on the negative aspect. Let's talk about the positive things, right, in regards to the opportunities and trends, right? So increased awareness, right? So by understanding this mental health statistics and the importance of this, right, and getting the information, right, provides us with, public campaigns and education efforts that have boost, recognition and the seeking the help of bringing awareness to these issues, right? So it's almost like, for instance, if someone ain't advocating for stuff, or you just don't know what's going on, right? Or no one's not providing that information, you'll never know, right? This is no secret society. Mental health is everywhere. We all are people. We need the self-care. We need the understanding. We need the information. We need the numbers. We need the statistics. We need to have understanding in regards to how we're able to improve our lives ourselves, so we're able to have be more proactive in our lives for our families, our communities, and even the world, right? So this is a major thing. So it provides that awareness for assisting additional help. We also have the telehealth expansion, right? So remote was able to help us even through that COVID time, where we had to be in that isolation based off of, the virus, right? But that provides the remote services in regards to improving, access for unserved populations, right? So for those out there that may be disabled, or their mental health, or they sick, et cetera, you may not be able to reach out to a clinician or have the access. You can have it on the phone. You can have it on your computer, right? You can have it on your tablet, right? So that telehealth expansion changed the game. In addition to that too, we also have the workplace initiatives, right? So employer-led mental health programs support early interventions and reduce stigmas, right? So for employers out there that are bringing into the workplace, teaching people about mental health, why it's important to have self-care in your life, why it's important to, maybe take that day off and put yourself first, right? These things, and having, the initiative in regards to mental health in those programs support the establishment and individuals, so, and it reduces the stress, et cetera, right? So we need to have these initiatives, and that's why I'm saying, on a positive note, this is why mental health is important. We also have youth resilience programs, right? So school-based programs that are going to be able to help, students support their coping skills and that emotional regulation, right? Because I've been telling people out there, on a real note, I'm black man my damn self, right? But, it's one mistake can cost us, right? So we got to be able to regulate ourselves, we know what's right, we know what's wrong, right? And we got to be able to balance out our emotions, right? We have our right to feel the way we feel, but we got to be able to do things in a positive, proactive way, right? So if you need to seek support, seek support. You need to be able to take that walk, take that walk. You need to be able to regulate yourself and do a deep breathing, do your deep breathing, right? So figuring out what your strengths are, figuring out what works for you, figuring out what activity is going to be able to help you feel much, much better. Even for myself, back in the days when I was over here getting myself tore from the floor, fights, et cetera, we'll talk about that another day, right? But I got myself some headphones, right? And I wasn't really in the mix anymore, right? I kept me really kind of neutral, kept me balanced out, right? But we got to be able to seek these support groups, right? Mental health is really important. We got to really be able to navigate some coping skills that's going to be able to work for you, to keep you neutral, right? Don't let no one trick you outside your position on that sense, right? But coming to a close, right? Why these numbers matter, right? So behind every stat is a real person, a real family, a real community, right? And someone in the world that is being impacted, right? So understanding the numbers help us respond with compassion and action, right? We need to know what's going on. We need to be informed, and not just for you, not just for me, right? But for your neighbor, for your friend, for that person out there that may need that support, that helping hand, but no one else is recognizing them because we don't have that awareness, right? So this is why it is important. This is why it matters. So let me just dive into some research, and we're gonna come to a close. You feel me? So in regards to that research, right, so tracking prevalence, those numbers, like once we talked about again, it provides that impact and access to gaps in regards to the guidance, effective policy, treatment, advances, in addition to that support services, right? So better data empowers communities, reduces that stigma, right? So mental health is important. I'm gonna say it again, right? Improving our mental health outcomes, in addition to strengthening resilience for not just you, not just for me, but for all of us, right? So if you found this video was beneficial, give it a thumbs up, share if possible, and I'll see you in the next one, right? Take care of your mental health is important. Take care of that self-care, figure out what you like, right? It makes you happy, what's gonna raise your vibration, so put that smile on your face, right? And do what's best for you. Self-care matters. Once again, take it easy.